before you come for Botox, there are some pre-care things you want to mention to the doctor or nurse that you're getting treated with. You want to mention any allergies you have, any neuromuscular disorders you may have. You want to let them know if you're pregnant or nursing, or any medications you're on, or medical conditions you may have. So what to avoid sometimes before and after with blood thinners and Botox is you definitely want to stop them about 5 days before and 3 days after. But if you are prescribed by your doctor to be on it every single day, you need their permission. Don't just stop them before you come in for a treatment. It's something you definitely want to check out. If you drink alcohol or take vitamin D 24 hours before or after your Botox treatment, it's going to increase your chances of bruising or some possible more side effects. If you have a big event coming up or anything like that, you really want to schedule your appointment at least 2 weeks prior, because you want to make sure that if you have any kind of pinpoint swelling or bruising going on, that it's gone down and resolved itself before your big event. Make sure on the day of your Botox you have a really good breakfast or lunch before you come in. You really want to have that in your system just to prevent any kind of weakness or faintness you may get if you have any issues with needles or anything like that. It's just going to really help you have that solid, healthy base before you go in for a treatment. The doctor will ask you some personal questions during your Botox appointment. Be prepared to ask or answer any kind of random questions that they may throw at you. They are a health professional. Everything is in perfect confidentiality and privacy, but just be prepared to answer any personal questions that the doctor may have for you. And you will have to provide your medical history just to make sure that you're suitable for the treatment. And that's to the doctor, so it's safe, like I said before, confidentiality. Just to make sure everything's good to go so you're ready to get your Botox and be happy with your results. Make sure when you come for your Botox appointment you have a list of all medications, supplements, vitamins, any other drugs you may be taking for the doctor, just to make sure there's no adverse effects that are going to surprise us because maybe you didn't mention something or we forgot about anything. So just make sure you bring a full list of anything you may be taking. We will be discussing with the doctor your alcohol consumption before Botox treatment, just to help prevent any bruising. So there will be some questions asked, but no judgment. We all have a drink every now and then, but it's a lot easier if you don't have it 24 hours before, and they will ask you. So you're going to have a consult with myself or the doctor during or before your treatment. I am the medical esthetician here, so if you have any questions beforehand, anything like that, or skin concerns that you have, just to make sure that Botox is actually the right thing that you want to go for. Sometimes what people's skin issues are not exactly, you don't need Botox, it might be something else you need. So that's why I kind of do the interference before you hit the doctor. And then yes, Botox, or yes, maybe another treatment. Basically, you're going to see your results from Botox within 3 to 14 days. And then within 2 weeks after your first treatment, we really want you to come back in for a follow-up, just to see if we need to make any adjustments to your treatment and how everything's settling.